everyone's got a 6% lifetime risk. But what would be the highest risk if you had a patient, if you had a couple clinical scenarios, someone that's had a lot of radiation, so doses larger than 60 to 70 grays, and I'm going to use grays and not the centigrays, and maybe they had radiation within this time frame and it's in the mandible. So just put all the most likely, if I had 4 scenarios, someone with a mandibular extraction within 4 months to 3 years and a higher than a 60 to 70 grade dose, they're at the most risk for radiation. So it's kind of like that trifecta, like, location is worse, timing's worse, and the dose of the radiation's worse, which is just really what I want you to know and memorize. And so that was the point of that question. Okay, so I went into a little bit about HBO and the fact that that's expensive, it's time consuming, and not a lot of literature and science behind it, and insurance does not cover it. But over the last maybe 10 years, there's been some studies on using pentoxifylline and vitamin E. They have to be taken together because they're symbiotic. If you take one and not the other, it doesn't work. And that has some reports that the patient takes this, it can help with angiogenesis, epithelialization, maybe preventing. It's low cost, it's low risk. That's kind of the biggest part of that question, that it's almost like, why not try it? It's not like HBO where it comes with this huge cost and time commitment. If a patient can take these pills and try to prevent osteoarthritis necrosis or improve osteoarthritis necrosis, that's the point of those medications. So radiation caries, the reason someone would develop that, and the slides is not that wordy, I think I talked about it more in lecture, that the reason patients develop radiation caries after radiation is because you're slamming all this radiation to their jaw, their salivary glands completely atrophy, they don't produce saliva, they just get high risk for radiation caries. So it's basically the xerostomia is so severe that this is the outcome. So that would be the biggest kind of connection there, and that's why they develop this. So it's not because they neglect their hygiene or they just don't care about keeping their teeth clean. It's just the secondary effect of basically avoiding, they get this significant xerostomia and it results in the caries. And then the chemotherapy in the dental patient, just remember, just wanting to get some labs, looking at complete blood count, not so much important. I think the biggest thing is here, you want to do dental surgery, before the therapy begins. 7 to 10 days, kind of like the radiation. I just wanted to hone in on, they haven't started it yet. When's an ideal time? Again, just remember, usually it's within 1 to 2 weeks. Get that dental surgery done, let them heal, and then they can get their chemotherapy started. And I think that's it. So that really is every single question I've gone through, and hopefully it's important to study this, and then it's part of the study guide too, if you need to go back. Any questions, concerns? Okay, sounds good. All right, and then it'll be